Service continues to engage constructively with recognised staff-side representatives regarding the current industrial action and associated actions short of strike, or ASOS. Since November of 2023, 3 of the 4 recognised trade unions within NIAS have been undertaking ASOS. The issues raised relate primarily to safe staffing levels, to staff welfare, and to the impact of prolonged hospital handover delays, which contribute to late finishes and reduced opportunities for rest. NIAS has established regular partnership forums with trade union representatives to review these issues, to monitor operational data, and identify actions to reduce the impact on staff. Progress has been achieved across a number of areas, with further improvements expected through ongoing hospital handover reform. This includes the release to rescue protocol, scheduled to go live next month. This will allow ambulance crews to safely return to the community when extended hospital handover delays occur, helping to restore capacity currently lost at EDs. NIAS continues to engage constructively with trade union representatives on the issues underpinning their action short of strike, including staffing, staff welfare, and the operational impact of hospital handover delays. And I'm scheduled to meet with trade union representatives and the ambulance service leadership later this week to discuss these matters further.
Well, Mr. Gaston.
Mr. Speaker, the late Willie Dara passed away at the side of the road on the 21st of December 2024 after suffering a heart attack. The initial 999 call from his wife Caroline was classed as a Category 2 call, and due to the action short of strike, wasn't passed to the crew in the local Ballymena ambulance station. Minister, will you commit today to meeting with the Dara family and also ensuring that this action short of strike is brought to an end, to ensure that no other family is left in the same position as the Dara family have been?
Thank you, Mr. Speaker. Well, first of all, my sympathies to Mr. Dara's family. It's a very regrettable loss of life there. Now, I do hope to see improvements in hospital flow. They're expected to help restore the capacity of the ambulance service. And the future operational approach to responding to Category 2 calls in the final hour of shift will depend on the outcome of ongoing discussions with trade union representatives, so I can make no promise there. Regardless, Category 2 calls will continue to remain fully visible, clinically governed, and actively managed at all times, even when immediate deployment is constrained by wider system pressures. And as to meeting Mr. Dara's family, of course, I will agree to that.
Linda Dillon.
And thank the Minister for his answers. Minister, the release to rescue protocol, is that definitely going to go live in April, as we had been previously told? And what is the impact what impact do you anticipate that will have on resolving the industrial action? And I just want to concur with the comments of Mr. Gaston around the death of Mr. Dara. I think that is very unfortunate, and I know that no ambulance service staff would want to think that they are leaving anybody lying on the side of the road, but unfortunately we are all in a position where we have had constituents that are exactly in that place. That is not because staff wanted to be that way, and I think that we need to be very cognizant of that. So how do we improve that, and what is the impact that you believe that would be had by the release to rest?
Well, I agree with the member. I don't think there's anybody working in health and social care who doesn't want to deliver the best for their patients and their service users. But such are the pressures, particularly around emergency departments, and the member will know this. There are nurses and doctors and our ambulance crew who are trained to do the right thing, the best thing for the patient, but because of the pressures and because of the numbers, too often they end up trying to decide what is the least worst option here. And that's not a single decision. Once you've made one least worst option decision, there's another one in your face, and then another one, another one, another one, for the whole of your shift. And that's why we get to this sense of moral injury and of staff and workforce going home and waking up the next morning and not looking forward, as they should do, to going on shift because they're not seeing any light at the end of the tunnel. Now, in terms of the release to rescue protocol, I have no indication other than it would go live in April next month. What it does, though, is it puts more pressure on the workforce within the ED department, because there's going to have to be a handover so that we can release the crew.
Neil McAllister.
Minister, for his answers so far. Minister, you just kind of pointed to what some of my question was going to be there. We have heard from some nurses who are concerned, and I know that the Royal College of Nursing do also have some concerns about this protocol, but we do have to do some things differently. However, what has the engagement been like with not only RCM but the emergency department and clinicians who are running this on the ground to ensure we have the buy-in, and ultimately who will be looking after the patients that are released to the hospitals so that the ambulances can go back into the community?
Well, as it happens, I was at Windsor Avenue this morning at a conference which is being run by the Royal College of Nursing. So I think the relationship there is good. But I go back to the point that I think I understand the pressures and that moral injury better than I am able to provide a proper solution to it, because that does require more funding and more resource. But in terms of this specific release protocol, I am not aware of any significant concerns, or maybe the concerns are significant, that's maybe a judgment call. I sense a willingness from within the RCN to try and make this work, let me put it that way.
Alan Chambers.
Thank you, Mr. Speaker. I'm glad that a further meeting is planned in the coming days. Whilst ambulance capacity continues to be lost due to prolonged hospital handover delays, I do very much welcome the significant improvements that have been made in recent months. Is the Minister hopeful that whilst all year-round pressures will no doubt remain, we are through the worst of the winter pressures, and therefore securing a sustainable end-of-shift protocol should be more achievable?
I think we are probably through winter, but the member will be aware that very early on I stopped talking about winter pressures and described them as additional winter pressures, because the pressures are on 24/7, 365. I am confident that we are moving in the right direction. I'm not satisfied that we're moving as quickly as I would like, but in the real world I think everybody is focused on trying to do better, and I'm very grateful to the staff and the workforce in health and social care, not least in emergency departments, who are trying to push for better.
And McCrossan.
Thank you, Mr. Speaker. Thank you, Minister, for your answers so far. Minister, in the last year, £10 million has been spent on private ambulance providers. Would this money not be better spent on the Northern Ireland Ambulance Service?
I recognise the point that the member is making. If we had a blank map and we were starting from scratch, absolutely. But we're in a position where the pressures, to some extent, are unprecedented. And if we don't spend the money on those independent services, then people don't get seen in a timely manner, or even less timely manner than they're being seen at the moment. So in an ideal world, absolutely. Is it a position I would like to move to? Absolutely. Would I like to be spending less on the independent sector generally? Absolutely. But we don't have the capacity to do what we need to do within the HSC.
Justin McNulty.
Kirsty Carr.
Minister.